keeping prescription medication out of the wrong hands and making sure people who need it get it.
That is the goal of a bill in the State House right now. WRTV's Meredith Hackler shows us how the program would work and why pharmacists say it could be a big benefit.
Pharmaceutical medication is one of the most expensive pieces of health care. But a bill at the State House would allow more access to people in need.
The most common one that we distribute is approximately $4,000 a month. And so, that's where it's really difficult to have someone who wants to donate medicine back.
Medication like that is why pharmacists are backing House Bill 1017. This bill would allow medical establishments to collect and distribute donated prescription drugs.
Some of these products are thousands and thousands of dollars, and they've never been opened, never been used. And so that just generates additional waste in the system that, we could save some of that. We could save some of the costs of drugs in the United States.
According to GoodRx.com, as of late 2021, there are 28 states that currently have this type of program. Brad Plunkett, the director of pharmacy services at the Damien Center, has worked in pharmacies where this program already exists.
I actually have worked in a couple of states that have repository laws already in place and, have seen the good that this can do for patients who, like I said before, have no other way to get access to medications.
He says this program is safe for several reasons. In the bill, it states that medication must be unopened, not expired, and is thoroughly examined by trained professionals. Plus, people have to have a prescription for the donated meds and meet income guidelines. Along with that, controlled substances like painkillers won't be accepted as donations.
There are lots of rules and regulations that are going to go along with this bill that we as the pharmacy will have to follow.
I talked with a few pharmacy customers who say this would be helpful to anyone in need.
That'd be great for the people that get it donated to, because they ain't got to pay for it, because I know that it's hard. Times are hard. Like I said, my mother paid $30 for a box of 3.
Well, creating better outcomes by people being able to afford or get their medicine.
Working for you. Meredith Hackler, WRTV.
The full House passed this bill unanimously and now heads to the Senate for consideration. Georgia's program was established in 2017 and has filled more than 450,000 prescriptions valued at more than $42 million.